So the very first thing is, they say, thank you so much for calling us today. May I ask who I'm speaking with? That's the control question. Then they tell you, say, great. Oh, I'm really excited to hear, okay, what you're interested in. Tell me more about why you called or your motivation. I like saying the term motivation because nobody gets any anymore. So you say motivation. Then once ever that patient starts talking, you say, this is amazing. So the praise and appreciate is just some uplifting words. Megan calls them high vibration. So high vibration is like reinforcing. It's like, this is amazing. Really? That's great. Hey, we love when people call us because they want to get their teeth clean, take care of their oral hygiene, hey, and move their health forward. That's great. Or say, oh, you're new to town and one of our patients told you about us. Wow. That happens to us all the time, all day long, as a matter of fact. But we take such pride, okay, in that we have a dental family who loves us and is loyal. So we're excited to welcome you to our team. Okay, so then I piggyback off that and then usually I would ask a curiosity question. Tell me more about. And then if they said something specific, right, we would add that. So tell me more about when's the last time you got your teeth cleaned, or tell me more about, okay, your need for having a new dentist in your life. That's a great, smart thing. You're going to love all of ours. Okay, tell me more about that. So some open-ended question of curiosity. So then ultimately now, so on the phone, it's more because it's like a new deal, right? So it's a new deal. The second part of that is tell them what's going to happen. Now we want to be mindful on the phone. We don't like go too into the details, but we go broad brushstrokes. So patient, I just want to share with you a little bit about our amazing welcome experience for our new patients coming in to see us. The first thing we're going to do after this phone call, bam, I'm going to send you, in fact, let's do it right now. Make sure you receive it. You're going to get a text from us. Boom, here it is. There's a little video. There should be. Okay, I want you to watch. It's from our doctors telling you all about our philosophy and just how we love to make people healthy for life. Okay, secondly, okay, we're going to get some paperwork. Boy, it's so critical. The worst way to have a terrible experience is to not get the homework done. And you're kind of like the student in this way coming to see the teacher. So I'm going to send you a little homework. Boy, get that done quick. Yeah, I'll be able to see that you did, and then we'll make sure it's all complete so you have the most productive experience when you arrive. Now, we talked about you coming next Thursday at 2. Okay, when you do, here's what's going to happen. And I just give a little play-by-play, but very high level. Is in a patient, here's what we pride ourselves in. Boy, transparency, okay, and really giving you great education about where your health is at and what is possible for your future. These are things that you're going to learn when you're here. And I would encourage you to write down some questions that come to your mind that you'd love to ask one of our dental professionals or our doctors when you're here with us next week. Now, patient, one last thing. We have found the most successful new patient experiences for us are when people bring someone they love, okay, or their spouse or significant other. And now, if we haven't found out if they're married or not, I said, if you don't mind me asking, are you married or have a significant other? And would they be able to join you on this first experience? It's often enlightening for them too. Okay, so you get my point. So it's all these different things. So I pretty much just checked every single box on earth. Now, you're not going to do that in every phone call, but like state of ideal. What state of ideal? Homework done right away. Consume the material. Write down some questions. Understand what you're really coming in for, not what you thought you were. And bring your spouse, who's going to be your biggest excuse to walk out the door and not say yes in the same day, and is going to be our low-hanging fruit referral. Now, if I'm also doing deposits over the phone, then I would weave into, that. Okay, but the main thing is you do what we call stay generous and curious. You give lots of generous comments back, and then you ask a lot of questions, which builds emotional connection, but it also makes it, you learn more. You learn more